Do you know the number one cause of type 2 diabetes? I bet many of you believe that it's elevated sugars or your poor diet or your lack of exercise or even your weight gain. And even though some of those things could actually be contributing to your diabetes, they're not the number one cause. You see, the medical system wants you to believe that the number one cause of your diabetes is your elevated sugars because they have pharmaceutical drugs to give you to lower those sugars so things look better on paper. But as many of you have probably experienced and what I've seen in over 20 years in working with type 2 diabetes is that people tend to get worse with diabetes no matter what, even though their sugars are in good ranges. And over time, even when their sugars start to increase again, what's the recommendation? More medication or increasing dosages. So this is not a real true underlying cause. It may be helping you to manage your diabetes, but today what I want to show you is I want to show you what's truly going on under the surface, what's really happening inside your body that is truly causing your elevated sugars and the progression of your diabetes. As you can see here, we have a diagram that illustrates my point of view, if you will, of what's really going on here. And we can see this is an illustration of your bloodstream. Now, inside the bloodstream, we have a couple different things that we have going on here. In my illustration, this blue dot is actually blood sugar. So this is your blood sugar in your body because we know that when you consume food, that food converts to sugar, right? The analogy I love to give is imagine if you have a car, right? Your car needs fuel in the form of gasoline to drive down the road. Well, your body is no different. Its fuel is glucose. So when you consume food and in the intestinal tract, it converts it to sugar, gets into your bloodstream, and now your body has the sugar that it needs. Now, the other thing we see here is this black dot is an illustration of insulin. Now, insulin plays a major role with blood sugar because the two of them have to pair up to allow the whole process to work. Now, where does everything happen inside the body? Because if it's just staying in your bloodstream, it's not doing anything. Actually, it's causing more harm than good. The sugar has to go somewhere. And that process or that area in your body is a very important area, and those are your cells. Because your cells have one purpose. The purpose is to allow those sugars to enter into the cell, into your engines, right? Using the car analogy again, the sugar or the fuel has to get into your engine. And this situation inside your cells, you have engines as well. And the goal is to bring that sugar into your cell. So how does that work exactly? Well, there's a couple things that have to happen. The first thing is we have on the outside of the cell, which is called a receptor. Now your cell has hundreds of these receptors, but in this illustration, we'll use one to make it easier for you to understand. And what happens is the insulin has to come down and attach to that receptor. Now, when that happens, a very magical situation happens. And there's a door in your cell that opens up. Why is that door important? Because that's going to then allow the sugar to enter inside your cell. Once that sugar gets into your cell and into your engine, that's where you're able to produce energy, or in the form of what's called ATP. And as a human being, you need this function. Have you ever wondered why, as a type 2 diabetic, you have low energy? You have no ability to function. You just feel like your brain is foggy. The reason is because you have a high percentage of your cells that are no longer accepting the sugar, and you can't produce the ATP, so you don't function as well. We all know as a type 2 diabetic that the risk of an early death is very high. And why is that happening? Because when enough of those cells become damaged, you die because you can no longer function optimally as a human being. This whole thing right here is the most basic fundamental function, and it's the number one reason why you're a diabetic. So the question is, why is this happening? What's going on here that's driving your diabetes? So let's use the same example over here. We'll draw another cell, and we have the same receptor outside of the cell, but this time we're not going to see the whole action take place. Because this time what happens when this insulin comes down, it's no longer able to attach to that receptor. It is being blocked. There's a blocking mechanism there that's no longer allowing the insulin to get into that receptor, which means imagine if you had a key, the proper key, but you couldn't get into your lock because there was something filling the lock. You couldn't open the door. And so the same thing happens here. If that blocks there, you can't open the door. So if you can't open the door, the sugar is never able to enter the cell. Now, if in one cell, you're never going to notice this. But what happens over years and years and years, and I teach our patients this every single day, that when you're diagnosed with diabetes, that's a diagnosis day. That problem started 10 to 20 years before because it takes multiple years, even decades, for enough of your cells to be damaged. Now, what is that threshold for you? It's unique to every single individual. That could be 10% of your cells, 15% of your cells, 20% of your cells before you start noticing this problem. And what does that problem occur? Well, if the sugar can't get into your cell, where's it going to go? It's going to start to rise in the bloodstream. So then you go see your doctor one day and they say, you have elevated sugar, you have type 2 diabetes. Change your diet, exercise, lose weight, take medication. All of those things are going to help you lower your sugar, but is it ever going to help you fix the cell? No. And this is why we see diabetes be a progressive disease process, because all of the focus is here and nothing is on here. And the reality is this: if you don't understand and don't find the actual mechanism that is driving this, this is only going to get worse over time. And the good news is there's a lot of things that can be done. There's comprehensive analysis that's currently not being done by your medical doctors, and there's reasons for that, that we do in our office to identify the specific reasons why these are being blocked. What's driving those problems? And I can tell you this, for most of the individuals that we work with in our practice, they'll have anywhere between 10 and upwards of 17 plus different problems that are contributing to this problem here, never just one or two. So you have to understand the full gamut of what's really going on. The good news is you have the ability. You don't have to live with this any longer. So this is just one step in the process of you identifying the cause and what needs to happen here to start helping you to reverse your diabetes. Reverse. We see our patients in our practice reducing and eliminating medications, losing weight without major exercise activities, and reducing the risk for future complications. If that's where you want to get to, make sure you continue watching these videos so you can learn more what's best for you to start reversing your diabetes. We'll see you next time.